Ryan Steinelson with Business Trends TV, and today I have Dr. Kyle Song on the line with me. He's with Song Plastic Surgery in Irvine, California. A lot of times, and how you doing, Dr. Song?
All right, how are you? Thanks for having me.
You bet. Glad to have you. You know, we get a lot of questions from our viewers about, specifically about breast augmentation, plastic surgery in general. I know that one of your specialties is breast augmentation, and a lot of people are concerned about having that procedure done. They don't know if it's for them. They're concerned about the financial aspect of it, etc. One of the questions that we get first and foremost is if I'm looking for a great plastic surgeon in general, what should I be looking for if I am looking for one, in your opinion?
I think that's a great question, and I think that's easily answered. If a patient has a friend or a family member that's been to a surgeon, they're going to trust their recommendation, they're going to trust their review, and they're going to go see that surgeon. Unfortunately, for most people, they don't know anybody who's seen a plastic surgeon, so you're starting from scratch. So, I think there's a couple of great things that you can do to find a surgeon that's going to meet your needs. I think first is finding a surgeon that's board certified. Foremostly, that's going to show that surgeon is safe. That's going to show that they're ethical, that they make good decisions, and that they provide effective plastic surgery. Second, you want to know, does this guy listen to his patients? Does he do a good job? For that, I would do a Google search review, look at the reviews, look at what his actual patients have written about him. If he's got great 5-star reviews on multiple sites, I think that proves he's going to offer everything you're looking for, and it's worthwhile going to meet him and having a consultation.
Yeah, those are great answers. So first and foremost is he board certified? Do they have the proper accreditation in order to do what they're saying they can do? And then looking online to see the reviews to see if they have a good bedside manner, etc. I think that's really good insight. Now, if somebody came to your practice and experienced your practice, what would that experience be like?
Our whole philosophy here is taking care of patients from our first interaction. So that's from their first phone call. We want to make them feel comfortable, and that we're going to accommodate and try to get them in when is a good time for them. Andrea will greet them in the office. She's going to talk to them, kind of find out what they're looking for, and from then on out, they basically just spend time with me. I don't have any other assistant or coordinator who's going to be talking to the patient. It's just the patient, their support person, spouse, family member, friend, and me, and we'll talk about what they're looking for and what I can offer them and what are realistic expectations. What's a typical recovery, and I'll show them pictures of patients that are like them, and so they can get a better idea of what's going to happen to my body and how can I expect to feel and look, one, through the recovery process, and two, once recovery is done and I'm at my final result.
Awesome. So you're going to really take them through with a high-touch type of environment where it's you and just one other assistant there that's going to walk them through, show them examples of what other patients that have gone through the same or similar surgery to them, so they can feel comfortable with the whole process. And I think that's great. So why don't we let me go in here. There's a few questions that we get a lot. One is it safe?
Yeah, that's a great question, and that should be everybody's first question. This is an elective procedure, so is it safe? And yes, on the properly picked patient, surgery is safe. And patients, I think a lot of patients don't realize when they're interviewing me and finding out if I'm the right surgeon for them, I'm also looking, are they the right patient for this operation? And so that's part of my process, is going through a medical history and doing a full exam and making sure that they are healthy enough to undergo surgery, and that they're also healthy psychologically to undergo this surgery. We only operate in accredited surgery centers. I only use board-certified anesthesiologists, so there's nothing that we skimp on for safety, and that is always our first and foremost concern. And so yes, if we do get to the point where we're doing surgery, we can almost guarantee that it's going to go very smoothly because we've done all the requisite work.
That's awesome. Another question that we get is how do you make it so that it doesn't look like plastic surgery? I mean, a lot of people are concerned. Well, I don't want to look like the Hollywood movie star. I don't want to have it look like, or my friends even know that it's been done. So how does what would you say to those people?
Yeah, a lot of people come in and say, I don't want the Real Housewives appearance. Some people even want to hide it from their closest friends and family members. And, plastic surgery doesn't have to drastically alter your appearance or the shape of your body. I think, plastic surgery well done just enhances your appearance, rejuvenates something. And I think done the right way with a surgeon who's had great training and has meticulous technique, you're going to get a nice natural look where you don't have the stigma of plastic surgery, where people will look at you and they'll think, man, you look good, or you wear those clothes well, you look well rested, you just got back from vacation, and they shouldn't be able to pin that, oh, you just had plastic surgery.
Got it. Yep. No, I hear you. Well, another question is can I afford plastic surgery? Like, I know that there's financing options for pretty much everything out there on the market. Can I finance some enhancing surgery?
Yeah, absolutely. And I think that's another big misconception, is that plastic surgery is so expensive. Some things may have a big price tag, but it is an investment in yourself. And yes, a lot of things are very affordable, and there are great financing companies, and we work with a couple that even have 0% financing, 0% interest for 18 months. And I think that really helps make plastic surgery within acceptable realm for most patients.
Wow. So if you got decent credit, you can actually get financing. I never knew that. So that's great. Now, is there any? Well, I know that you have some sort of a special, like, first-time patient offer. What is that? Or you were going to do something, I think, in coordination with this presentation that you were doing?
Yeah, absolutely. I want to welcome anybody who's seen this video and wants to come in. We offer complimentary consultations, so we'll talk, show you pictures, show you what you can expect, and also if you mention this, I'll give you a 10% off of any surgery you're looking at.
Awesome. So if you just go ahead and mention maybe the word hangout to the doctor, that'd be great. Awesome. So now, any other parting words to people that are watching?
I think just that I think if somebody comes in for a consultation, we can put to rest a lot of myths and misconceptions about plastic surgery, and it's much easier to answer questions about your own body and what you can expect, and how is this process going to be, and what's the exact price of the surgery. I can give everything to that in a consultation. Like I said, they're complimentary, so just come in and talk, see photos, and do that anytime.
Awesome. Well, hopefully we've gotten through some of the misconceptions just in this video and help people to at least develop some sort of a know, like, trust relationship with you before they even come in. And obviously for the one-off, for the individual questions, yeah, I mean, go on in,